Today we are going to start inshallah with the respiratory system. Our topic of discussion would be the larynx, and later on we will discuss the feature of the trachea and the lungs in the coming videos. But today let me start with the introduction of that respiratory system. This respiratory system, as you know, is providing the real exchange of oxygen and CO2 from the blood, and it includes the lungs and its branching system. You know it as a bronchiolar trees and bronchioles. Air is moved into the lungs by the ventilating system, and it needs the assistance of your thoracic cage, intercostal muscles, diaphragms, and the diaphragm and the elastic component of the lung tissue. So functionally, we would say anatomically, the lung is basically divided into the upper and the lower respiratory tracts. Functionally, the system has two components: the conducting portion and the respiratory portion. So for this, I have to show you another diagram. Let me focus on that. The conducting portion. This diagram is again showing you the upper respiratory tract that includes your nasal cavity. Part of sinuses are also there. Then you are supposed to enter into your pharynx. Then the lower respiratory tract, they have mentioned the larynx, trachea, the bronchi, and the lungs. And finally, we have to enter into the place where it is labeled as bronchiole, which are respiratory bronchioles, alveolar ducts, alveoli, all the lot. Here, the real gas exchange takes place, the oxygen and the CO2. Now we have to focus through this nasal cavity. The very initial part is called as vestibule. So what it is lined by the epithelium of the skin, which is stratified squamous. Inside, non-keratinized would be expected, and we have got the hairs called as vibrissae to trap the particles or dust from the inspired air. And next to it, we must expect the sweat gland, the sebaceous glands in it. Then we enter into the nasal cavity upper part. Now see the upper concha, this is bony shell, then the middle concha and the lower concha. These are the parts of the nose you will come across in detail when you get to study in second year the head and neck. But here we are supposed to learn its histological feature. The respiratory epithelium is the main epithelial lining that you have to come across in your trachea as well. So the respiratory epithelium basically consists of 5 types of cells. As you know, epithelium always rests on basement membrane. This basement membrane is thick. You can see it lined with the 5 type of cells. The ciliated columnar cells, the cilia over it, the most abundant variety. Now there is another variety you can see. These are the goblet cells. The basal nuclei is there. They are not lined with the cilia. Rather, they have got few microvilli over there. Then there is another variety of the cell which are less numerous, called as brush cells. They are also columnar cells acting as a chemoreceptor, sensory receptors, and they have to be making synapses with the afferent nerve endings on their basal surface. Then there is another variety of the cells, small granule cells. They are also called as Kulchitsky cell, Kulchitsky cells. They are rather difficult to be distinguished in routine preparation, but their dense core granules, they are a part of diffuse neuroendocrine system. They just make up the 3% of the cells in this respiratory epithelium. Then last but not the least are the basal cells, which are very mitotically active. So they work as a progenitor or stem cell, so that they are supposed to give rise to other epithelial cells. Now, after that, we have to discuss another type of epithelium. So I have to move on towards another diagram. This is focus on that. Here you can see this is another epithelium which we call it as olfactory epithelium, that covers your upper superior concha or the nasal cavity inside on its superior surface. Now, how they are appearing? This olfactory epithelium has got three types of cells in it. The main cells are the olfactory receptor cells. You see them as a sensory bipolar neurons. They have got dendrites and a dilated olfactory hair like bulb area, and they are supposed to act as or to work with the chemoreceptors and to meant for this odoriferous molecules of sense of smell they are supposed to take, and through their axons they are supposed to pass through the in the skull, the cribriform plate of ethmoid you will learn in the head and neck in the skull. So many axons of these this olfactory receptor, they join to form small nerves combine to form a larger one, and they are going to form your olfactory nerve. Olfactory bulb is there, you can see. This is your first cranial nerve, rather meant for olfaction. And after that, there is another type of cell you are observing here is the supporting cells. They are giving support. They are most numerous. You can call them as tall columnar or sustentacular cells. Few microvilli on their apical surface as well. There is mitochondria and a smooth endoplasmic reticulum is there inside, but rough endoplasmic reticulum is in the limited amount. Then we have got the basal cell as well, close to basal lamina. They are also meant to perform the function of a stem cell or reserve cell. They are supposed to differentiate into the rest of the epithelium. They can be replaced within a month or two so that the olfactory epithelium should be maintained. Some books write that there are brush cell as well, but in a much smaller number. So these are the important thing we have to know about this respiratory system. Now we will continue after that about the topic of our practical, the